from the College by the Lake, Coeur d'Alene, Idaho. Local, regional, national, and international guests discussing the issues and topics affecting the way you live are on Forum, the North Idaho College Public Forum, with your host and moderator, political scientist Tony Stewart.
Welcome to today's program. We're very pleased to have on the program Dr. David B. Gerber, who is a veterinarian. The purpose of today's program is to discuss the treatment and the cure of small animals, and certainly our guest, Dr. Gerber, is highly qualified to do that. Our guest holds a baccalaureate degree from Colorado College that was received in 1971, and then he graduated from the Veterinary School of Colorado State University in 1978. He's also active in our community and makes many contributions. Dr. Gerber, welcome to the program. It's a pleasure to have you here.
Thank you.
And I'm very pleased to have two panel members today to question our guest. To my immediate left is Margaret Fedge, who is a member of the counseling staff at North Idaho College and certainly comes to us with not only her academic background, but has certainly had many years' experience with small animals, and she will be highly qualified to discuss this subject. And next to her is Steve Schenck, who is the Dean of College Relations and Development at North Idaho College, and he, like Margaret, is a lover of animals, and between the two of them, they have had many visits to Dr. Gerber's office with their animals. And with that, we will proceed with the question. We'll ask Margaret Fedge to commence the question.
Dr. Gerber, certainly when we think of a small animal practice, we usually think of cats and dogs, and yet it seems like there are so many other pets that people have these days. What kinds of animals do you see in your practice?
Well, primarily we do see cats and dogs, I suppose, in terms of numbers, but we also see, I guess, what we call pocket pets. The little mice and the gerbils and the rats, little critters like that, an occasional rabbit. We see quite a few ferrets. I would say from Great Danes on down, as small as they get. Is
there a difference in the kind of care that, let's say, a gerbil or a hamster would need and the kinds of things that a cat or dog would need?
Well, you know, husbandry certainly is fairly similar. They all need food, they all need water, good food, good water, bedding, and certainly a lot of attention. There's been a lot less research done with the little critters in terms of vaccinations for diseases and such, so we don't do anything that way on a routine basis. Probably most of the problems you run into with those little guys are related to husbandry, dietary problems and such. They also tend to live for a very short period of time, so old age often is the biggest problem you run into.
So we're not looking at inoculations, we're not looking at neutering,
Correct.
We're not looking at those things for the small animals?
Well, neutering occasionally. Not too often, but
okay.
Yeah, occasionally we'll get into that.
Okay.
Steve Schenck.
David, we all of us who love animals anyway would love to be able to eliminate those people who simply don't care about their pets. That's not going to be possible through this program, but I wonder if you could tell us what kinds of inadvertent care problems you see. People who really do want to give their pets good care but are missing some important steps.
I think that's a good question. It's one that I feel embarrassed about because I think we tend to take a lot of that responsibility ourselves. For instance, yesterday a woman brought a pup into us with a disease called parvovirus, which is a fairly severe disease that dogs will get, usually young dogs, and it's often fatal. She'd never heard of the disease. Well, that's not her fault, that's our fault. And I think that the inadvertent problems are those of lack of education on our part. It's really our profession's, I think, responsibility to educate people in terms of what vaccinations are available, such as for that disease. There's a very effective vaccine that's inexpensive and highly effective. Spaying and neutering is an area where I think that we have a great responsibility to the public to say, hey, you know, there are a lot of unwanted pets out there, and let's see what we can do to maybe prevent that. And a lot of it is strictly a lack of knowledge.
I may move into a controversial issue here, but we'll see how it works. In addition to pet owners who may not be as well prepared for their ownership function as they might be, there are pet providers who are not as well prepared for that function as they might be. Do you see that as a problem in our area? Are there people who are running kennels who have decided that a good part-time business is to breed pets that really don't know what they're doing?
Yeah, you run into that some. I think we call those the backyard breeders, and we tend to then see a lot more of the medical problems show up and also behavior problems. because of maybe improper breeding or line breeding, we call it, maybe breeding a father to a daughter, things of that nature. And again, it's mostly a lack of experience and a lack of knowledge. It certainly is not a way you're ever going to make any money. And we do run into that occasionally. A lady brought in 2 German Shepherds a couple years ago, and she said, well, I'm going to supplement my income, I'm going to breed these dogs. Well, of course, it never worked out. You lose money. And the good breeders will say if they can pay for their dog habit or their cat habit by breeding occasional litters, then they're pretty pleased with that, you know. So, yeah, I think you run into that occasionally. Again, I think most people are pretty well-intentioned. I really do. Mm-hmm. They just don't know. And the other thing you run into is people that get into pet ownership and don't realize that it's a responsibility, not only time but also financial. And that's a great frustration to us. You know, we go to the Humane Society and we get this cute little puppy, and he grows up into a dog, and maybe we vaccinate him, and then he goes out and he breaks his leg because he wasn't, you know, on the leash and he was in the street. And now what do we do when we have a $600 bill? Well, you know, we really weren't prepared for that. Well, then that puts everyone in a particularly difficult position, and the dog most of all.
If Tony will allow me one more question, you've led into another area that I have a real interest in, and that's matching people with the right kind of pet. Do you provide any counsel? And this is not a sidelight for you, I know, but if people come to you and say, gosh, we're thinking about pets, our children really want a pet, or I want a pet, can you give people any general guidelines that'll help them make sure that they don't make a mistake that if they're good, conscientious people they're going to live with for the next 10 or 15 years?
We would love to do that as a sideline, really. That's a service that we would be very pleased to offer because we're the ones that experience the fallout from bad decisions. Mm-hmm. An older couple came in about a year ago with about a 100-pound Rottweiler that basically was running the house. That was not only difficult for them, it was real difficult for us because this dog said, why run those people? I might just well run you too. And he did. Nice dog, nice people, just too much dog for those people. Had we had a chance to speak with them earlier on, maybe when they were looking for a puppy, I think we could have saved some problem that way. We would love to do more of that because, you know, good ownership and happy ownership obviously leads to a long relationship between owners and pets, which means they're going to bring their dog in more and our business is more successful. So there's certainly something in it for us too to see these long-term relationships work out.
Dr. Gerber, I had the pleasure as the producer of this program some years ago to do a 5-week series with Washington State University's Veterinary Medical School, and it's one of the finest in the country. And while we were there doing taping and so forth, I acquired some information about their work in both large animals and small animals. And one of the things that intrigued me at the time was the research they were doing, and also at the same time trying to help people with their animals to prolong their life, the animals, if they could do it with quality. And they were involved with pacemakers and other really medical breakthroughs. And I was watching this take place. I have really a 2-part question, and the first part is, where are we now today? What is the status of the intervention with modern medical technology and prolonging life of small animals? Is the first question, then I'll come back with the other.
Okay. There was a program on one of the 60-minute shows, or one of those couple of years ago, I guess, regarding some of the technology that is available now in veterinary medicine, and what they were saying on that show was fairly true. And in fact, even at Washington State University, they have the capability now of doing CAT scans and MRIs, which is a very useful tool, not just a way to spend a lot of money. Pacemakers are being used more routinely now. Fortunately, we're able to get those used, truly, and they can be implanted without a great deal of expense in dogs. Not cats so much, they're a little too heavy. The cats would sink if they went swimming, I think. But most of the things that are available in human medicine are now becoming available. Our biggest limitation is cost. If we decided we were going to try to split 2 Siamese twins, and that didn't sound right, did it? 2 Siamese twin kittens, probably the money wouldn't be there. Heart surgery is certainly being done now. There's some brain surgery being done now. Actually, that's been done for quite some time. But most of the things that are available in human medicine are now available in veterinary medicine if the dollars are available. That's the biggest limitation.
I assume that it's also going over into medications that control certain aspect like heart trouble and so forth.
Sure. And many of those things are similar. The medications that we use, we tend to steal from human medicine, then we have to just figure out dosages. Interestingly, a lot of those dosages were first worked out primarily in dogs. Dogs are often the model used in human medicine for heart research because the heart and cardiovascular system is pretty similar. So that's the biggest problem there, is getting the dosage figured out correctly. And again, the cost. Some of the new medications are tremendously expensive in human medicine, and Blue Cross hasn't yet said that they're going to help cover that.
Mm-hmm. The second part of my question you've almost addressed near the end of your answer to the first, and that is, from this research and work, not only are, I assume, families very happy that they have their animals longer, but some of the techniques and all that are used there, I mean, it's vice versa. It can be used on humans, and then you said that oftentimes you pick that up in veterinary medicine. But don't you also find from the vet schools around the country that some techniques are learned that can be shared with the medical profession as partial or complete treatments for human beings also?
Yeah, I think that, as I said, a lot of the research done in human medicine is first done using animals, and that gets into a whole potentially controversial, not potentially, but a controversial area. I guess my feeling about that is that if somebody is going to do open heart surgery, which first was done on dogs, on my mother, I would prefer that that surgeon had done some before, maybe on dogs, rather than on my mother as the first one. The hypothermia technique, which is used in human medicine to cool down the entire cardiovascular system for heart surgery, was first done on dogs in Colorado, I believe, in Denver.
Margaret Fedge.
Okay. Following up a little bit on Steve's first questions about problems caused by inadvertent ignorance, it seems like as a pet owner, over the years, as I bring my animals in, there are more and more inoculations that can be given, more and more diseases are covered. And how do I, as a responsible pet owner, what kinds of things should I expect to do? If I go to the Humane Society or go to my friend and get a puppy or a kitten, what kinds of inoculations am I looking at being able to give these animals, and what would be responsible ownership in terms of the kinds of inoculations to expect? What would I, as a responsible pet owner, expect to do with just a kitten or a puppy?
Do you care about specifics here, or are you
No,
asking more generalities?
I'm just asking just generally what
Yeah.
kinds of
Okay.
shots would you expect?
I certainly, the way we try to do it in our practice, and I think most practices are similar, is customize that to each individual pet, depending on their exposure to other pets, to the environment, where do you live,
Mm-hmm.
you know, you're way out in the country where your cat's never going to be exposed to anything, are you in the inner city, do you have 10 cats in your home, do you have 1 cat in your home?
Mm-hmm.
All of those things are factors in terms of which vaccinations and protective type things should and shouldn't be done. For instance, a totally indoor cat or dog, well, probably not a dog so much, but totally indoor cat probably doesn't need to have a stool sample check for internal parasites because there's no way they're going to pick them up. So the vaccinations that are becoming available, there are many now for some of the nasty diseases that cats and dogs can get, and it's pretty incredible. There's a disease called feline leukemia that's truly a leukemia-type disease, and is caused by a virus that we can actually look at under a microscope or an electron microscope, and will cause, in some situations, a form of cancer. We can vaccinate against that. That's fairly remarkable, I think, and I think going back to Tony's question, can this be used in human medicine? Yes, indirectly it can. Some of those same principles of virology certainly do apply. Cats also get a form of AIDS, too, which does not affect people. But the virus is very, very similar, and certainly research is parallel there too in terms of protection and potentially a vaccination which is not yet available. But
Steve Schenck.
David, any epidemic kinds of problems in this area affecting dogs or cats?
right now, fleas.
Fleas. Been through that
In the
problem.
late summer of the year, it's fleas, and they're nasty. This parvovirus I was talking about tends to be a fall disease here. We're not really sure exactly why, but late summer and fall, we tend to see more of that.
Let's talk a little bit about fleas, because I've had that experience.
Well, this is only a half-hour show.
Yeah, we can't recount my whole personal battle against those rascals, but I can tell you from experience that it not only affects the animal, it affects the pet owner if you allow your pets in the house. What should people do? What's the best way to make sure it's not going to get to be a problem for you?
Cry. It's a difficult problem, and I think the biggest problem that most people get caught on is that they will only try to kill the adult fleas. Here's this little flea, I can see it, I'm going to kill it. Okay, that's easy to do. That takes care of a very, very, very small percentage of the problem, because you also have eggs and larvae and pupa that need to be dealt with, and they tend to be much more prevalent in the environment. So for just treating your pet with a spray or a powder or a dip or whatever is a very small part of the problem. The rest has to be your home, and that's the biggest problem that people run into.
Now, our flea problem ended when we moved from an area that was heavily treed, lots of shady areas, to a yard that was more open and I assume drier. Is that a
that would help? Yeah.
Be aware that those things, those rascals,
Sure.
breed in the damp, moist,
Yeah,
dark areas.
in the corners of the yard. They tend not to be in the center of your yard so much as they do in the dark corners. And the same with your home. They're going to be in the corners of the woodwork and underneath the couch cushions and places like that. Yeah.
You mentioned earlier feline leukemia and a form of feline AIDS, neither of which affect humans. Are there diseases that pets contract? We all know about rabies, of course, but are there other diseases that pets contract that can be a threat to their owners?
Yeah, there are a few. I would say probably the most popular one is a disease called toxoplasmosis that is of some concern to pregnant women. It's a parasite that cats can get. They're the definitive host for that, and they can pass that in their stools. It's rare that they will pass that in their stool, and they will only pass it for about a 2-week period in their life, the first time they're infected with it, and then not again. It's probably much more common to get that infection from eating rare beef.
Is the reverse ever true? Any of our ailments inflicted on our pets?
Yeah, strep throat is a common one, and if you're in a family that with young kids that are continually getting strep throat, you might look toward your dog as a sort of a temporary carrier and treat your dog because that dog could act as a temporary carrier and not even show signs of disease and then give it back to the kids. But usually the dogs get it from the kids. One thing that doesn't pass back and forth, and since we're in September and school's just started, are lice. Human lice do not affect pets. Pet lice do not affect people. And everybody's kids are going to be coming home with lice here very soon because that seems to happen every fall. So that is not one that will pass back and forth.
We've had medical doctors and psychologists specializing in children on this program, and they've talked about that when a family has a 2 or 3 year old child and another child is born in the family, how do you go through the adjustment process? And there's a lot of techniques. I would assume there's some similarities when a family has a dog or a cat, for example, and they're 8 or 10 years old. I had a friend recently say to me, I know that dog won't live too much longer, and therefore I'm having a pup to come on, so we'll have another animal. But isn't there adjustment in those situations? What do you recommend to families when they're bringing young, new animals into the family where an animal's had the run and the attention of the family?
Well, that's a sort of a two-pronged question. One is when you bring a new baby into a home where the pet has been lavished with attention, and that's a very common thing. The best pet owners often are the best parents because they're putting their parenting, nurturing instincts, if you will, with that pet, and then when they have a child, that shifts to the child, and the pet says, "Now wait a minute, I thought I was number one here, now I'm not, I'm number two." And it's extremely difficult in those situations, and we actually have some booklets that we hand out to people about introducing your baby to your dog or introducing your dog to your baby, and it can be a real problem, and usually our very best pet owners are the ones that have the greatest problem. That happened, in fact, this afternoon. A woman brought in a new dog that she'd gotten because she had to get rid of her old dog because the dog hated the new baby and she was afraid that the baby was going to be hurt, and very possibly could have been. So there's some things you can do, such as before the baby comes home from the hospital, maybe bring a blanket home from the hospital and let the dog have it and sniff it and roll in it and do whatever so they can get that scent a little bit. When you bring the baby home, the mom's been away from home for a bit of time, don't have the mom carry the baby, let dad, who's been home, carry the baby in and let mom greet the dog. Let the dog around the baby. Dog germs aren't going to hurt babies, you know. I mean, if you use common sense, you're going to be fine. I think you shouldn't leave them together unattended, but you want to make sure that that pet still gets, you know, a great deal of attention. That pet was there first.
How about another young dog or cat coming into the family with older dogs and cats?
We might even have Margaret answer that question.
She's had experience.
She's had lots of experience. That can be very difficult. Now, dogs will tend to accept a new pet more easily than a cat will. Cats tend to be very territorial and pretty possessive of their environment and don't like so much having new ones come in. One technique that we'll use particularly with cats is spraying both of them with a bit of perfume or talcum powder, the old cat and the new cat, and then that throws their scent mechanism off just a little bit, and they both smell like each other, and they say, well, gee, maybe this new one's okay. It smells like I do.
Maybe it's a relative.
Yeah, it's a relative, right. We're cousins, distant. Or put one in the bathroom and one out and let them just kind of sniff underneath the doorway, things of that nature. Slow introduction.
Margaret Fedge.
Okay. I have a two-part question. What I'm discovering with my animals as they're getting older, I'm looking at different kinds of health problems that they're coming up with. What kind of problems are you seeing with older pets? What kind of diseases or illnesses are they? That'll be the first part of the question. Let me ask you that first.
Okay, I would say probably the first thing that jumps to mind, and you're right, pets are living a lot longer. We didn't used to see 20-year-old cats. We do quite often now, and 15, 18-year-old dogs. With that, as with human medicine, you start seeing newer problems developing. Certainly cancer is one of the things that we'll see. Probably the most prevalent one is dental disease, though. As pets get older, they live long enough for their teeth to become a problem. And that's a very, very common thing that we probably didn't used to see when dogs didn't live to be 8, 9 years old. And I guess cancer would probably be the other one, that dogs are living and cats are living old enough to develop cancer. Very common cause of death in both.
One of my animals ended up with a thyroid problem, which surprised me that at first I wasn't even thinking that a cat could have a thyroid problem. Pretty much any kind of human problems you're going to end up seeing in animals?
That's a disease of older cats. Actually, that's the opposite of the human thyroid problem. Most human thyroid problem is a deficiency of the thyroid hormone. Cats, and this is a disease of older cats. In fact, when I graduated in 1978, that was a disease that we didn't even know about. So it's fairly new, and it's an overactive thyroid problem. That I think the youngest that's ever been diagnosed is in a 7-year-old cat. I had a cat in this afternoon, a 15-year-old cat, I'm pretty sure has a hyperthyroid problem. We'll know that by tomorrow, but that was number one on my list of things. Well, the cat's 15 years old. 20 years ago, the cat probably would have been dead.
As cats are living longer, and as dogs are living longer, as our pets are living longer, we come eventually to the point where we're probably going to have to make some decisions about how long and quality of life, and is it time to euthanize them or not. Do you have some guidelines that you can talk about in terms of making that very difficult decision? Yeah,
I do. First of all, quality of life, I think, is maybe an overused term, and it's one I use all the time. I was at a meeting on veterinary oncology last fall in Portland, and the presenter was saying, that we have how are we doing time-wise? We're okay here for a couple of minutes. She was saying that, and she treats a lot of pets with cancer, and she lives in Marin County, California, so the resources are available. But she was saying, we have such a luxury in veterinary medicine treating cancer in pets because our goal is so different than treating cancer in humans. In humans, it's to prolong life. She said, that's not what we're trying to do. We're trying to prolong high-quality life. And if we give a therapeutic agent that causes your dog to vomit, we're going to stop it, and we're going to stop it right now. We're never going to use it again. We're done. And then we'll maybe try something different. So our goal is to make that pet feel better and have a better life. And I think that I've been around enough people with cancer, and you guys probably have too, that sure doesn't seem to be the goal. It seems to be, let's make this person live longer. And I have some problems with that.
Steve Sheen.
David, compare and contrast for me, if you would please, your medical practice with one of your colleagues who treats human patients. Any interesting similarities? Any interesting differences?
Yeah, I think there probably are a lot of differences. Our pets have a lot of fur on them. Our patients, they walk on all 4 legs. But I would say
your bedside manner is primarily at saving you from being bitten. That's a
right.
problem for a human doctor.
There are exceptions.
Restraint sometimes, I guess. No, I would say the main thing, the main things that are contrasting is that we tend to be more limited in terms of what we're able to do because of cost, because the insurance of that third-party provider is not available in any great degree. Pet insurance is available, but it's a very, very small thing right now. So our availability of some of those things, although it's there, we really can't utilize it, not only in terms of diagnostics, but also in terms of pharmaceuticals. That's a frustration. And yet, we deal with it. People say, well, how can you possibly, find out what's wrong with this dog or cat? They can't talk. Well, they also don't lie to you. If it hurts, they'll bite you. And so it's not as tricky as a lot of people would like to think. Often they will tell you, they just don't tell you in words. They use body language, and they're pretty specific about that usually.
If I were going to guess, I would say that you're probably closest in problems and in practice to a pediatrician.
Yeah.
Their patients frequently can't
That's
tell
exactly
them either.
right.
And I would think that you've got to treat the owner like you treat, like a pediatrician treats a parent. Is there?
Yeah, exactly. And I think that's a very accurate comparison. Yeah.
What about training? Tell us. You kidded around just a little bit before the show and said, "What training? I haven't been to school." How does your medical training compare to that of a doctor?
Well,
a doctor of human medicine,
sure.
I should say. You're a doctor.
Certainly high school, and then 4 years of college, and then 4 years of veterinary professional school. And then beyond that, I haven't chosen to do it, but there's board specialties available, which Coeur d'Alene is really too small to support. There are now three specialists in Spokane. There's a reproduction specialist and an ophthalmology specialist, and one other surgical specialist in Spokane. Certainly we have a lot of those folks available at WSU, Washington State.
In Coeur d'Alene, is there? You don't do large animal practice at all, do you? And that's pretty much a standard differentiation in the veterinary medicine field, or not?
A lot of people, I shouldn't say a lot. Some practitioners do only large animals, some do only small, and some do both. I have enough trouble keeping current, at least what I feel is reasonably current, with just the small animals. I always have a stack of journals at home that I'm usually a month or two behind in, and I can't imagine expanding that to 3 or 4 more species and being current.
Something we talked about before we went on the air too, and I wanted to bring it back up for our viewers. And that is when that difficult time comes that a family must have a pet put away because it's in such pain, but they've had the cat or the dog or whatever the animal is for a very long time, and they bring it in. Do you have any advice of how to do this? We discussed whether they should stay with the animal when this takes place or whether they should leave the animal with you. What would you advise the public?
It's a real individual decision, and as I had said before, when we started our practice, we really did not want owners present, and I think that was due to our insecurity probably as much as anything. What if something goes wrong, things of that nature. And we've really come around 180 degrees on that and decided that that's a very personal decision. I would say the majority of people don't want to be present, but if people do, I think that's absolutely the right thing to do, if that's what they want.
On that note, we have to bring the program to conclusion, and on behalf of our panel and our staff, Dr. Gerber, thank you for being with us. You've been generous with your time and came away from your practice to do this, and we appreciate, and I know our viewers have found this very informative and helpful with their animals at home. Thank you very much.
Thank you.
Ladies and gentlemen, I know you've enjoyed our program, and I'd like to invite you to be with us again next week at this same time, and we will discuss another subject that we think that would be of interest and significance to you. Until then, please have a good week. I am Tony Stewart.
The North Idaho College Public Forum was videotaped live from the studios of Telemedia Services on the campus of North Idaho College for viewing at this more appropriate time. We invite you to join us again next week for another all-new edition of the North Idaho College Public Forum on this public television station.